Dear Minister of Health, he's just leaving, so it's the last moment to greet him. Mr. Vitya, dear Director of the National Institute of Public Health, Dr. Nazer Ramadani, dear Alexander Martinenko, Head of WHO Office in Pristina, dear representatives of professional chambers, dear representatives of Parliament, estimated speakers, distinguished guests. I'm pleased to address you on this occasion when we unite to confront a global challenge that knows no borders. Non-communicable diseases remain a global challenge responsible for claiming the lives of 41 million individuals annually, which accounts for 73% of all deaths. Even more concerning is the fact that 77% of these NCD-related fatalities occur in low and middle-income countries and have a direct effect on a country's economic growth. According to the World Health Organization, cardiovascular diseases account for most NCD deaths, or 18 million people annually, followed by cancers, 9 million, respiratory diseases, 4 million, and diabetes, 1.5 million. Kosovo's healthcare system faces a major issue with non-communicable diseases like many other countries worldwide. Number of cases of hypertension, diabetes are constantly increasing. Although being highly prevalent, they are underdiagnosed and poorly controlled. In Kosovo, the COSCO cohort study found that the highest present risk factors for NCDs is poor nutrition, 85% of the respondents, followed by physical inactivity, 70% of the respondents. It is for this reason that Switzerland, through its cooperation program, has placed a special emphasis on enhancing the quality of healthcare services for chronic patients in this country. The Swiss-funded project, Accessible Quality Healthcare, AQH, and Integrated Health Services, IHS, which are currently being implemented by the Swiss Tropical and Public Health Institute here in Kosovo, are designed to support the implementation of the national reform agenda and complement other programs in primary healthcare and secondary healthcare, with a special focus on non-communicable diseases, NCDs. Thus, our approach to sustain quality services for chronic patients is really comprehensive. Chronic cases are not only highly prevalent, but they are cases that need long-term accompanying and care, starting with health education and health promotion to manage the risk factors and to avoid aggravation, and continuing with integrated care. It is in our scope to improve availability, quality and continuity of care for chronic patients by strengthening professional and managerial capacities and by putting the patient at the center to become an active player. We have supported and will continue to support medical education for health professionals. Hundreds have been trained in the provision of essential services for chronic patients, in communication with patients, and in offering motivational counseling. In addition, as a result of health education and health promotion activities, the patients are more informed on their rights and responsibilities, especially on those related to their own role as self-managers of their health condition. It is estimated that 80% of heart disease, stroke and diabetes, and 40% of cancer could be prevented by addressing the main risk factors. The two Swiss-funded projects in health support and facilitate this 3-day international symposium on NCDs. We are delighted to witness the outcomes of our sustained efforts being showcased at this symposium organized by the Ministry of Health and the National Institute of Public Health. This event provides us with an opportunity to gain insight into the present situation, the obstacles, but also the enablers, and to the strategy for the future. Emphasizing non-communicable disease on Kosovo's national agenda is of utmost importance as a primary focus for the years ahead. We remain, Switzerland, committed to supporting our local partners in enhancing the quality of services for individuals dealing with chronic health conditions, with a special focus on the vulnerable groups. I want to express my gratitude for your presence here today and for your valuable contribution to this symposium. I wish you fruitful exchanges and discussion. Thank you.